You can go ahead.
Hi everyone, my name is Sydney. Okay. Hi everyone, my name is Sydney Weaver.
And my name is Sabrina Soa, and today we'll be presenting on diagnosing and discriminating childhood apraxia of speech from other speech sound disorders.
Speech sound disorders are among the most prevalent types of communication disorders for young children, but it can be very difficult for clinicians to discriminate childhood apraxia of speech from speech sound disorders as many characteristics overlap. There is not a lot of evidence-based guidelines that exist for discriminating between the two, as children may present with characteristics that indicate more than one speech sound disorder. So it is very important for clinicians to choose the right assessment tools and to take the right measures to analyze a child's speech production to form an accurate diagnosis.
And then we have our results. So we did find that there is something called the pause marker proposed by Schreiberg et al. And that is a diagnostic marker that could potentially discriminate childhood apraxia of speech from speech delay. And then we have Murray et al. Compared expert diagnosis of childhood apraxia of speech with 4 quantitative measures. And these measures were able to discriminate apraxia from other speech sound disorders with a 91% accuracy. And that's what you can see in our figure at the bottom left of the poster. So the characteristics of syllable segregation, lexical stress matches, and then the percent of phonemes correct in a picture naming task, and then an articulatory accuracy activity, like those 4 things together, were able to predict a diagnosis of apraxia with 91% accuracy. And then we also have a table from Strand, and it says that children can exhibit certain characteristics for other phonological disorders, but may exhibit them more frequently for apraxia. And children who exhibited at least 4 of the characteristics across at least 3 assessment tasks were included in the apraxia group. So Sydney can go ahead and talk about that table, which is in the middle of our poster.
Yeah, so Strand created this table with some characteristics that are more discriminative of childhood apraxia of speech. So she found that if children exhibited at least 4 of these characteristics across 3 assessment tasks that she used, they were included in the CAS group. And it turned out to be pretty accurate. As you can see at the top, the first area, these are characteristics that are usually present but not discriminative. So like people or children with speech sound disorders may discriminate these as well, but the bottom section are more discriminative characteristics of childhood apraxia of speech. And then if you look at the bottom right at figure 3, many studies are contributing to a creation of a standardized guide for diagnosing CAS, which is very helpful, as there is not really a assessment task right now that is for CAS.
Okay, and then we can move forward into our discussion. So just to open that up, distinguishing childhood apraxia of speech from phonological disorders and other speech sound disorders remains a clinical challenge, but this body of evidence is promising.
And just like we said before, Murray's study narrowed down 4 characteristics that are accurate in predicting CAS. That's the figure to the left.
And Schreiberg's findings provide support for the pause marker as a near conclusive diagnostic marker of CAS. The pause marker can be described as an inappropriate pause between words.
And in Strand's table at the top, again, this summarizes common characteristics of CAS, and she stressed the importance of the frequency of certain traits. So if children are exhibiting these more frequently, it's more likely that they have CAS.
And these studies together indicate that it is possible to differentiate CAS from other phonological and speech sound disorders.
Further direction should include forming a standardized guide for clinicians to diagnose CAS. Like I said, there's a lot of uncertainty in this area, in this field.
And something that might go hand in hand with that is a study by Westby. She identified 2 tests that appear central to differentiating CAS from other disorders: So the tests are the real word polysyllabic test and the non-word Patuca task, which is just like an articulatory task. They were motorically challenging and appear to successfully elicit behaviors that reflected the underlying motor planning and programming deficits in apraxia. So this is a good start to putting together a conclusive guide to diagnosing it, but more research definitely needs to be done.
And overall, it is crucial that clinicians are able to accurately diagnose CAS and distinguish it, so that we are able to serve and treat the child to the best of their ability. Um, and yeah,
And
so
then I just have to summarize our discussion. We have the figure, it's at the bottom right of our poster. So if we put together the 4 characteristics from Murray's study, we have the pause marker, we have the table at the top of our poster, and then we have the 2 tests that may be used to diagnose CAS and differentiate it. So if we put all of those together, hopefully future directions will be to put together a standardized guide for the diagnosis of childhood apraxia of speech.
And to conclude everything, ultimately, it is crucial that clinicians are aware of the common characteristics of CAS and are taking the correct measures to discriminate CAS from other phonological disorders. As you can see, this can be very challenging for clinicians as many characteristics between the two can overlap. But there is a lot of evidence out there right now that's promising. Again, we have Murray's 4 characteristics, strengths table, and Westby's 2 tests that are helping clinicians to come up with a diagnosis. But overall, there is more research needs done in this area as this field is growing immensely. It is not only important for clinicians to provide an accurate diagnosis, but to make sure the child is receiving the best treatment possible.
All right, that's everything we have. Thank you everyone for watching.
Yeah.